If you are over 60 and your mornings feel harder than they used to, I want you to stay with me for the next few minutes, because this may explain more than you think. A lot of people wake up and assume the tiredness, the stiffness, the shaky feeling, the brain fog, or the dizziness is just part of getting older. But very often, that is not the full story. What happens in the first hour after you wake up can shape how strong, steady, and clear you feel for the rest of the day. And some of the biggest problems I see are not dramatic at all. They are quiet. They are common. And they are easy to miss until they start affecting your balance, your energy, your blood pressure, your memory, and even your confidence. I want to make this simple and useful. We are going to walk through 5 morning habits that can help you feel stronger all day. These are not extreme health tricks. They are not miracle fixes. They are small, steady habits that support the body you live in right now. And here is the important part many people miss. It is often not one big thing making you feel weak. It is several small things pulling in the wrong direction at the same time. By the end of this video, you may notice one habit that has been quietly draining you every morning without you even realizing it. And the last habit may be the one that protects your independence the most. Before we get into it, I would love to hear from you. Tell me your age in the comments, or tell me which part of mornings feels hardest for you right now. Is it low energy, dizziness, stiff joints, poor sleep, blood pressure worries, or just not feeling steady on your feet? And if this kind of calm, honest health guidance helps you, make sure you subscribe and stay close. My goal is to help you feel safer, stronger, and more confident in daily life. If you have a friend, spouse, parent, or neighbor over 60 who keeps saying, "I just don't feel right in the morning," please share this with them too, because one small change could make their whole day easier. Let's start with the habit that sounds so simple people often skip it. Give your body water before you ask it to do work. After hours of sleep, your body naturally wakes up a little low on fluids. That may not sound serious, but even mild dehydration can leave you feeling weak, foggy, headachy, constipated, or lightheaded. Some people notice dry mouth. Others do not. Some people simply feel off. Their heart may seem to race a little more. Their legs may feel heavier. Their thinking may feel slow. If you take diuretics, which are water pills, or medicine for blood pressure, diabetes, or kidney problems, morning hydration can matter even more. Now, I am not telling you to force down a huge amount of water all at once. That is not necessary, and for some people it may not feel comfortable. What I am saying is start your day gently with a few slow sips of water before coffee, before chores, before rushing around. Keep a glass by the bed or in the kitchen if that helps. This habit is not exciting, but it supports circulation, digestion, and muscle function. It may also help you feel less sluggish and more clear. If your doctor has told you to limit fluids because of heart failure, kidney disease, or another medical reason, follow that advice and ask what a safe morning amount looks like for you. The goal is not more for the sake of more. The goal is enough for your body. Now here comes the second habit, and this one is about safety as much as strength. Do not rush from lying down to walking. Many older adults stand up too fast in the morning, especially if they need the bathroom, hear the phone, or feel behind before the day even starts. But when you rise too quickly, your blood pressure can drop for a moment. That can lead to dizziness, blurred vision, wobbling, or even a fall. And falls after 60 are not small events. One bad fall can change confidence for months. It can make people afraid to walk, afraid to bathe, afraid to leave the house, and afraid to trust their own body. So give yourself a pause. When you wake up, sit on the edge of the bed for a moment. Move your feet. Roll your ankles. Take 1 or 2 slow breaths. Let your body catch up before you step forward. If you use a cane or walker, bring it close before you stand. If you often feel dizzy, make that pause a non-negotiable habit. This is especially important if you take blood pressure medicine, sleep medicine, or certain medicines for pain or anxiety. Here is the part many people miss. Feeling dizzy when you stand is not something to simply accept forever. It is something to notice. If it keeps happening, tell your doctor or pharmacist. Sometimes the cause is dehydration. Sometimes it is medication timing. Sometimes it is blood pressure changes that need attention. And I want to say this calmly and clearly. If morning dizziness comes with chest pain, fainting, trouble speaking, severe shortness of breath, new confusion, or sudden weakness on one side of the body, do not brush it off as a bad morning. Get urgent medical help right away. There is a difference between common morning lightheadedness and a warning sign. You do not need to panic, but you do need to take those red flags seriously. The third habit may be the one that changes how your whole body feels by lunchtime. Move before you melt into the chair. I know that when you wake up stiff, sitting down with coffee can feel like comfort. And sometimes that is fine for a few minutes. But if the body stays still too long after waking, stiffness can become heavier, balance can feel worse, and energy can stay low. Gentle morning movement helps wake up the muscles, joints, circulation, and brain. It tells your body, we are up now. We are using this machine. And your body often responds with more steadiness than you expect. This does not have to mean exercise clothes, a gym, or a hard workout. It can be a slow walk through the house. It can be stretching your arms up and opening your chest. It can be 10 sit-to-stands from a sturdy chair, if that is safe for you. It can be standing at the kitchen counter and lifting your heels a few times. It can be a short walk outside to get some fresh air and morning light. The point is not intensity. The point is movement with intention. Many older adults notice that once they start moving, their hips loosen, their back relaxes, and their mood improves. Even digestion can work better when the body is not stuck in stillness all morning. And morning light deserves a quick moment here, because it is powerful in a quiet way. Opening the curtains or stepping outside for a few minutes can help your body clock know the day has started. That can support better sleep later, which can improve the next morning too. It is a simple circle. Better morning light can support better evening sleep. Better evening sleep can support better energy, mood, and balance the next day. These little things connect more than most people realize. Now let's talk about the fourth habit, because this is where a lot of people unknowingly lose strength. Eat a breakfast that truly supports your muscles and your brain. Many adults over 60 either skip breakfast, eat very little, or eat something quick that fills the stomach, but does not fuel the body for long. A sweet pastry, sugary cereal, or toast alone may taste fine in the moment, but it often does not give steady energy. A short time later, you may feel sleepy, hungry, shaky, or foggy again. If you already worry about blood sugar swings, weakness, or cravings, this matters even more. A stronger breakfast usually includes protein and some fiber. That could be eggs and oatmeal. It could be plain yogurt with berries and nuts if chewing those foods is safe for you. It could be cottage cheese with fruit. It could be peanut butter on whole grain toast and a boiled egg. It could be beans, leftover chicken, or a simple bowl of oatmeal with milk and seeds. It does not have to look fancy or perfect. It just needs to do real work for your body. Protein helps support muscle, and after 60, protecting muscle matters more than many people think. Muscle is not just about looking fit. Muscle helps you stand, walk, climb stairs, carry groceries, and catch yourself when you lose balance. Here is the part many people miss. One reason daily tasks feel harder with age is not only joint pain or tiredness. It is also loss of muscle over time. And muscle loss does not always announce itself in a big way. It sneaks in. The laundry basket feels heavier. The walk to the mailbox feels longer. Getting out of a chair takes more effort. You begin using your hands to push up. You stop taking certain stairs. You tell yourself you are just being careful. Sometimes you are. But sometimes your body is quietly asking for better fuel and more movement. If you live with diabetes, kidney disease, digestive problems, or trouble swallowing, your breakfast may need special planning. Please do not make major changes without checking with your doctor or a dietitian who knows your health history. The right breakfast is the one that supports your needs safely. But in general, a breakfast with protein and fiber is one of the smartest morning habits for energy, strength, blood sugar support, and fewer crashes later in the day. Now we come to the fifth habit, and I told you earlier this one may protect your independence more than you expect. Take one quiet minute every morning to check in with your body and your medicines before the day gets noisy. This is not about fear. It is about awareness. Ask yourself a few plain questions. How do I feel today compared with yesterday? Am I more swollen than usual? Am I short of breath? Am I unusually shaky? Is my thinking clear? Did I sleep flat, or did I need extra pillows? Have I used the bathroom normally? Do my legs feel steady? Have I taken my morning medicine the right way? That last question matters a lot. Many older adults are managing several medications. Mornings can become automatic. The same bottle, the same routine, the same habit. But that is exactly when mistakes happen. A pill gets taken twice. One gets missed. A medicine that should be taken with food gets taken on an empty stomach. A blood sugar medicine is taken, but breakfast is delayed. A supplement is added without checking for interactions. These are everyday problems, and they can have real effects on dizziness, blood pressure, energy, stomach upset, and confusion. So slow the moment down. Keep your medicines in a clear system. If your doctor or pharmacist has helped you build a schedule, follow that. If something feels confusing, ask. And this is very important. Never stop a prescription medicine suddenly just because a video, article, or friend said you might not need it. Some medications must be changed slowly and safely. If you think a medicine may be causing morning weakness, dizziness, swelling, or stomach trouble, bring that up with your healthcare professional. You deserve a medication review that makes sense for your current life. This 1-minute check is also where you can notice early warning signs before they become bigger problems. New swelling in the legs. A sudden jump in confusion. Black or bloody stools. Fainting. Severe weakness. Chest pressure. Trouble breathing. Very low blood sugar symptoms like sweating, shaking, and confusion. Those are not signs to just wait and see all day. Those are signs to get medical help quickly. Strong mornings are not about ignoring symptoms. They are about noticing them early, calmly, and wisely. And there is another hidden benefit to this fifth habit. It gives you a sense of control. A lot of people over 60 tell me they feel frustrated because their body seems unpredictable. One day is good. The next day feels harder. That can be scary. But when you slow down and check in, patterns start to show. You may notice that the dizzy mornings happen when you skip water. You may notice that the shaky mornings happen when breakfast is too light. You may notice that poor sleep leads to worse balance. You may notice that a new medication seems to line up with a new symptom. This kind of awareness is powerful because it turns a vague problem into something you can discuss clearly with your doctor. Now let's put these 5 habits together the way real life actually works. A strong morning is not one perfect act. It is a chain. You wake up and give your body a little water. You sit before standing so your blood pressure has time to adjust. You move gently so your joints, muscles, and circulation wake up. You eat a breakfast that actually supports energy and muscle instead of just filling space. And before you rush into the rest of the day, you take one quiet minute to notice your body and stay on track with medications. That is not a complicated routine, but it is a powerful one. Let me give you a simple picture. Imagine 2 mornings. In the first one, a person wakes up late, jumps out of bed, feels dizzy, skips water, drinks coffee on an empty stomach, sits for an hour, then grabs something sugary and wonders why they feel weak by noon. In the second one, that same person wakes up, sips water, pauses before standing, walks a little, eats protein with breakfast, and takes a minute to make sure their medicines and body feel on track. The difference may not look dramatic in the first 10 minutes. But by midday, it can feel like 2 different lives. And please hear me on this. If your mornings have been rough lately, that does not mean you are failing. It does not mean your best days are over. It may simply mean your body needs a steadier start. Aging well is not about doing everything at once. It is about respecting what the body needs now. Small changes done daily often help more than big plans that last 3 days and disappear. If all you do tomorrow is put water by the bed and sit before standing, that is a good start. If next week you add a better breakfast, that is progress. If you begin taking a 5-minute morning walk, that matters. I also want to speak to caregivers for a moment, because I know many of you are watching for someone you love. If your parent, spouse, or family member seems weaker in the morning, do not assume they are lazy, difficult, or just not a morning person. Look closer. Are they drinking enough? Are they getting dizzy when they stand? Are they eating a real breakfast? Are they taking several medicines that may need review? Are they afraid of falling and hiding it? Sometimes the most loving thing you can do is help build a simple morning routine that feels calm, safe, and doable. The truth is, many of the things people fear most after 60 are tied to ordinary mornings. Falls, fatigue, brain fog, blood pressure swings, trouble walking, loss of confidence. These problems often grow in the spaces we stop paying attention to. That is why I wanted to make this video. Not to scare you, but to remind you that strength is often built in quiet ways. In the glass of water. In the pause before standing. In the walk to the window. In the breakfast that feeds your muscles. In the 1-minute body check that keeps small problems from being ignored. So tomorrow morning, do not ask yourself to become a new person. Just choose one of these habits and begin there. Keep it simple. Keep it kind. Keep it steady. Then let that one habit become part of who you are. Over time, these small changes can support better energy, better balance, better focus, and more confidence in your own body. That is what most people really want. Not perfection. Not a miracle. Just the strength to move through the day with a little more ease and a little less fear. If this helped you, tell me in the comments which of the 5 habits you are starting with tomorrow morning. I would truly love to know. And if there is another topic you want me to cover, like blood pressure, memory, leg pain while walking, safe ways to improve balance, or questions to ask your doctor about medications, leave that in the comments too. Stay close, take good care of yourself, and if someone you love needs this reminder, share it with them today. Sometimes the smallest morning habit can open the door to a much stronger day.